Nursing process. 50 questions and answers with rationales. Part 2. Question 26. A patient reports pain 8/10 but refuses pain medication. What is the appropriate action by the nurse? The options are: A. Administer the medication without consent. B. Document that the patient is non-compliant. C. Ignore the patient's refusal. D. Reassess the patient's understanding of pain management options. The answer is D. Reassess the patient's understanding of pain management options. Rationale: the nurse should reassess the patient's understanding and offer alternatives for pain management while respecting the patient's autonomy. Question 27. Which nursing action best represents the implementation phase? The options are: A. Assessing the patient's pain level. B. Administering a prescribed medication. C. Documenting the patient's complaints. D. Rewriting the care plan. The answer is B. Administering a prescribed medication. Rationale: the implementation phase involves carrying out the interventions outlined in the care plan, such as administering medications. Question 28. When a nurse is planning care for a patient, which statement represents a measurable outcome? The options are: A. The patient will demonstrate proper handwashing technique before discharge. B. The patient will understand how to take their medications correctly. C. The patient will improve their physical strength. D. The patient will feel more comfortable in 2 days. The answer is A. The patient will demonstrate proper handwashing technique before discharge. Rationale: measurable outcomes include specific, observable, and achievable criteria, such as demonstrating a skill like handwashing. Question 29. The nurse is prioritizing care for multiple patients. Which patient should the nurse assess first? The options are: A. A patient complaining of a mild headache. B. A patient who is anxious about discharge. C. A patient with a respiratory rate of 32 breaths per minute. D. A patient with a blood pressure reading of 120/80 mmHg. The answer is C. A patient with a respiratory rate of 32 breaths per minute. Rationale: a respiratory rate of 32 indicates respiratory distress, which requires immediate assessment and intervention. Question 30. A nurse evaluates a patient's care plan and determines the set goals have not been met. What is the nurse's next action? The options are: A. Continue with the current care plan. B. Discharge the patient. C. Notify the physician to change the treatment. D. Reassess the patient's condition and modify the care plan. The answer is D. Reassess the patient's condition and modify the care plan. Rationale: when goals are not met, the nurse should reassess the patient's condition and make necessary modifications to the care plan. Question 31. A patient presents with shortness of breath, edema, and weight gain. Which step in the nursing process is most critical for developing an effective care plan? The options are: A. Assessment. B. Diagnosis. C. Implementation. D. Evaluation. The answer is A. Assessment. Rationale: accurate assessment is key to understanding the patient's condition and determining appropriate interventions to address issues such as shortness of breath and edema. Question 32. During the implementation phase of the nursing process, the nurse is responsible for, the options are: A. Determining the nursing diagnosis. B. Identifying patient strengths and weaknesses. C. Performing nursing interventions. D. Setting measurable patient outcomes. The answer is C. Performing nursing interventions. Rationale: in the implementation phase, the nurse performs the planned interventions to help achieve the patient's goals. Question 33. Which of the following nursing diagnoses would be considered a priority? The options are A. Activity intolerance. B. Disturbed body image. C. Ineffective airway clearance. D. Risk for impaired skin integrity. The answer is C. Ineffective airway clearance. Rationale: ineffective airway clearance is a priority diagnosis because airway management is essential for survival, whereas the other diagnoses are important but not immediately life-threatening. Question 34. A nurse is developing a care plan for a patient with a risk for pressure ulcers. What is the most appropriate nursing intervention? The options are A. Apply lotion to dry skin areas. B. Assess skin every shift for redness or breakdown. C. Turn the patient every 4 hours. D. Provide a high-protein diet. The answer is B. Assess skin every shift for redness or breakdown. Rationale: frequent assessment of the skin is critical to prevent the formation of pressure ulcers. Turning the patient every 4 hours may not be frequent enough. Question 35. When evaluating the effectiveness of an intervention, the nurse must consider which of the following? The options are A. How long the intervention took. B. The cost of the intervention. C. The patient's subjective and objective responses. D. Whether the patient likes the intervention. The answer is C. The patient's subjective and objective responses. Rationale: the effectiveness of an intervention is evaluated by looking at both subjective data, patient's report, and objective data, measurable outcomes. Question 36. A patient is admitted with dehydration and confusion. What is the nurse's priority during the assessment? The options are A. Assessing the patient's vital signs. B. Monitoring the patient's intake and output. C. Performing a skin turgor test. D. Reviewing the patient's medical history. The answer is A. Assessing the patient's vital signs. Rationale: assessing vital signs is the priority to determine if there are any immediate life-threatening issues such as abnormal blood pressure or heart rate. Question 37. Which action is part of the assessment phase in the nursing process? The options are A. Administering prescribed medication. B. Developing nursing interventions. C. Gathering information about the patient's condition. D. Identifying patient goals. The answer is C. Gathering information about the patient's condition. Rationale: the assessment phase involves collecting data about the patient's health status, including physical assessments, interviews, and reviewing records. Question 38. A patient's care plan includes the nursing diagnosis of risk for infection related to surgical incision. What is the most appropriate nursing intervention? The options are A. Monitor the patient's blood pressure. B. Encourage the patient to rest. C. Educate the patient on proper hand hygiene. D. Assess the patient's fluid balance. The answer is C. Educate the patient on proper hand hygiene. Rationale: educating the patient on hand hygiene is an appropriate intervention to prevent infection, particularly for someone at risk due to surgery. Question 39. The nurse is evaluating a patient's response to a pain management plan. The patient reports no relief from the pain. What should the nurse do next? The options are A. Discharge the patient. B. Continue with the same interventions. C. Document the patient's pain without taking further action. D. Reassess the pain and modify the care plan. The answer is D. Reassess the pain and modify the care plan. Rationale: if the current interventions are ineffective, the nurse should reassess the pain and modify the care plan to better address the patient's needs. Question 40. Which of the following is an example of a long-term goal for a patient with hypertension? The options are: A. The patient's blood pressure will be 120/80 mmHg by the end of the shift. B. The patient will verbalize an understanding of the importance of medication adherence within 2 days. C. The patient will maintain a blood pressure below 140/90 mmHg for 6 months. D. The patient will consume 1,500 mg of sodium per day by tomorrow. The answer is C. The patient will maintain a blood pressure below 140/90 mmHg for 6 months. Rationale: long-term goals refer to outcomes that will take place over weeks or months, such as maintaining a healthy blood pressure over 6 months. Question 41. During which phase of the nursing process does the nurse determine the effectiveness of the care plan? The options are: A. Diagnosis. B. Planning. C. Implementation. D. Evaluation. The answer is D. Evaluation. Rationale: the evaluation phase involves determining whether the patient's goals have been met and if the interventions were effective. Question 42. In the nursing process, which of the following would be considered a nursing diagnosis? The options are: A. Congestive heart failure. B. Diabetes mellitus. C. Risk for falls related to unsteady gait. D. Pneumonia. The answer is C. Risk for falls related to unsteady gait. Rationale: nursing diagnoses are based on patient responses, not medical diagnoses. Risk for falls addresses a potential health issue caused by an unsteady gait. Question 43. A nurse is assessing a patient who has difficulty breathing. What type of assessment should the nurse perform? The options are: A. Initial assessment. B. Focused assessment. C. Comprehensive assessment. D. Emergency assessment. The answer is D. Emergency assessment. Rationale: an emergency assessment focuses on identifying life-threatening conditions that require immediate intervention, such as difficulty breathing. Question 44. When creating a care plan, which type of nursing intervention is the nurse implementing when they turn a bedridden patient every 2 hours? The options are: A. Independent intervention. B. Dependent intervention. C. Interdisciplinary intervention. D. Collaborative intervention. The answer is A. Independent intervention. Rationale: independent interventions are those that a nurse can perform without a physician's order, such as repositioning a patient to prevent pressure ulcers. Question 45. What is an appropriate outcome for a nursing diagnosis of impaired skin integrity related to immobility? The options are: A. The patient will have no pressure ulcers by discharge. B. The patient will be turned every 2 hours. C. The patient will be given adequate nutrition. D. The nurse will apply dressings to pressure ulcers. The answer is A. The patient will have no pressure ulcers by discharge. Rationale: outcomes should be patient-centered and measurable. No pressure ulcers by discharge is a specific and realistic goal for skin integrity. Question 46. When the nurse writes a care plan goal that states, the patient will demonstrate proper use of an inhaler within 48 hours, the nurse is performing which phase of the nursing process? The options are A. Planning, B. Implementation, C. Diagnosis, D. Evaluation. The answer is A. Planning. Rationale: in the planning phase, the nurse sets goals for the patient based on the identified nursing diagnoses and patient needs. Question 47. Which data should be collected first during a head-to-toe physical assessment? The options are A. Abdominal contour, B. Heart sounds, C. Skin turgor, D. Level of consciousness. The answer is D. Level of consciousness. Rationale: assessment of the level of consciousness is a priority, as it can indicate neurological function and overall patient stability. Question 48. Which of the following is an independent nursing intervention? The options are A. Administering pain medication, B. Inserting a Foley catheter, C. Teaching the patient how to use a walker, D. Performing a sterile dressing change. The answer is C. Teaching the patient how to use a walker. Rationale: independent nursing interventions do not require a physician's order, such as teaching a patient how to use medical equipment. Question 49. When developing a care plan, which outcome is appropriate for a patient with a nursing diagnosis of activity intolerance related to chronic obstructive pulmonary disease, COPD? The options are A. The patient will walk 100 feet without shortness of breath by the end of the week. B. The nurse will monitor the patient's oxygen levels every hour. C. The patient will consume a healthy diet every day. D. The patient will quit smoking immediately. The answer is A. The patient will walk 100 feet without shortness of breath by the end of the week. Rationale: the outcome must be specific, measurable, and relevant to the nursing diagnosis. Walking 100 feet without shortness of breath directly addresses activity intolerance. Question 50. What is the primary purpose of the evaluation phase in the nursing process? The options are A. To gather information for diagnosis, B. To revise the care plan based on patient progress, C. To educate the patient on their condition, D. To implement the interventions outlined in the care plan. The answer is B. To revise the care plan based on patient progress. Rationale: the evaluation phase focuses on assessing the patient's progress toward the established goals and determining whether the care plan needs revision. Thanks for watching. For more videos, please subscribe to this channel. You may share the video with your friends. Don't forget to click the thumbs up and you may leave a comment for the next topic questions practices.